I come in?
Yes.
Okay. Hi, I'm Julia. I'm a student nurse from Oakland University. Today I'm going to be taking care of your hygiene, so your oral care, hair care. I'm going to be giving you an in-bed bath, changing the bed, changing your gown, and getting you all ready for the day.
Yes.
That should take about 15 minutes. Is that all right?
Yes.
Okay. I'm going to wash my hands. I'm closing the curtain for privacy. I'm making sure I have all my equipment, which I do. And then I'm going to lower down the railing and raise the bed up to working level. And then I'm going to start out with your oral care. So I'm going to raise the top part of the bed so that you're comfortable with oral care. And then I'm going to place down a towel to protect from any liquid that gets down when I brush your teeth. So before I start your oral care, I'm just going to take off your blanket here. So I'm folding each side in, and then I'm going to fold it up so that you don't get skin cell or debris anywhere. And then I'm going to set it on the chair so that we can reuse it later.
Yes.
And then I'm just going to lay the bath towel on top of you.
Yes.
Yes, thank you. Okay, and then can you just hold up the bath towel with both of your hands for me? Thank you. Okay, and then, sorry. So I'm rolling the sheet out from underneath the patient to protect his privacy and then to prevent his skin from being sheared at all. And then I'm putting the sheet in the hamper. And then you can let go of the bath towel. And then I'm just replacing the towel for the oral care. So now I'm washing my hands, I'm putting on gloves, and then I'm going to set a water basin on the patient's chest so that he can spit, and then I'm getting a cup. So when I brush the patient's teeth, I'm brushing from the bottom of the gums to the top of his gums, or to the top of his teeth, brushing inside of his mouth, the tongue, and the roof of his mouth. And then here's some water, you can spit. Okay, do you need more water?
No.
Okay. So now I'm taking the toothbrush, the container, and then the glass, and then I'm cleaning them, and then I'm setting them to the proper location. And then I'm disposing of my gloves. If the patient was comatose, I would turn them over to the side, make sure the bed was raised high enough to where they could still breathe, and then I would use suctioning along with the toothbrush. And then if the patient had dentures, I would take them over to the sink and wash them with a toothbrush in the sink, and then I'd put them in a cup labeled on their bedside. And we don't shave the patient's faces. That's taken care of by the family. So now that we've done your oral care, I'm going to move on to washing your face. So I'm washing my hands, changing my gloves, getting bath water. Do you just want to feel the water with the back of your hand? Tell me if it's warm enough for you.
It's good.
All right, thank you. Okay. So I'm going to, I'm taking the towel from the oral care and then putting it in the hamper. I'm coming back, and then I'm going to wrap the washcloth around my hand and tuck it in. And then I'm going to wash the patient's face from the inner to outer part of both of their eyes using a different section of the towel for each part of their face. Washing around their face, washing their neck, and then the back of their neck. And then I'm going to get a new mitt, or a new towel. And then I'm going to wash the patient's limbs. So I'm going to lift up his arm and support his joint, and then place a towel underneath it, and then lay that arm down. Taking a new washcloth, I'm going to wash both of the patient's hands, the top part of their hands, the bottoms, their fingers, and in between their fingers and their nails. I'm doing that on both sides with different parts of the washcloth. And then I'm going to get new bath water and then get a new washcloth. And I'm going to wash the patient's arms from the distal to the proximal portion of the patient's arm. So from the wrist all the way up into their armpit. I'm going to do that for both of the patient's arms, and then put on deodorant for them. And then I'm going to take a different towel and pat and dry both of their arms. Then I'm going to get a new rag I'm going to remove the towels from the patient's arms and then get new towels and then place the towel underneath the patient's leg. Can you lift your right leg for me? Okay?
Thank you.
Yep. Can you just bend up your right leg? Thank you. So I'm getting the a new rag and I'm washing the patient's feet. So I'm washing the top part of their feet, the bottom of their feet, their toes, in between their toes and their toenails. I'm doing that for both of the patient's feet, and then I'm getting new water and a new rag. And then I'm gonna wash the patient's calves from their ankle all the way up to their knee, being gentle to avoid dislodging any blood clots. I'm doing that for both of the patient's legs, and then with the towel, I'm patting the patient's legs dry. So then I'm gonna remove this towel and then put it in the hamper. And then for the next part of the in-bed bath, I'm getting a new rag, and then I'm gonna wash the patient's chest and abdomen. So if the patient was female, I would, with gloved hands, lift up the breasts with one hand and then wash underneath them. And the male patient, I would just wash his chest and then get underneath any crevices or folds in his stomach area, using a different portion of the washcloth for each section. And then I'd get a new rag and new water. So do you need to use the bedpan at this time?
Yes.
Okay. So the patient needs to use the bedpan. So if the patient was able to move himself, I would assist him in lifting up his hips, and then we'd slide the bedpan underneath him. But since this patient isn't able to, I'm gonna help him turn over to his side. So I'm gonna get on new gloves, I'm gonna get my bedpan, and then I'm gonna have the patient lift up his right leg. Lift up your right leg.
Oh.
And then set it over to your, on your left leg, and then turn onto your side.
Oh.
Oh my god, AJ. Okay, so then I'm gonna place the bedpan into the mattress so I don't pinch the patient's skin. I'm gonna have him lay back over on it. Okay, so I'm gonna offer the patient tissue and then a call light. And because the bed was flat when I was giving him the bath, I'm gonna raise back up the bed so that he's able to use the bathroom in a comfortable position. I'm gonna raise the rail, and then I'm gonna leave the room. Just let me know when you're done.
I'm finished.
Okay. So now that the patient's done, I'm gonna lower the railing. I'm gonna lower the bedside back down. I'm gonna wash my hands and put on new gloves, and then I'm going to hold the bedpan and assist the patient to turning back onto his side. I'm holding the bedpan so that it doesn't spill. I'm taking this. Can you lean over? Thank you. Okay, so I'm taking the patient's bedpan and the pee pad. I'm disposing of the pee pad in the bathroom, washing out the bedpan, and then I'm going to put both of these in the proper place. I'm coming back to the bed where I have the rail raised, and I'm turning the patient back to his side, and then lowering the railing again. So now I'm putting on new gloves, and I'm getting a new rag with new water, and we're doing hernial care. So for this, I'm washing the patient's thighs, outer and inner thighs with different sections of the rags, getting a new rag. And then for a male patient, I would wash from the head of the penis down, wash the scrotum area, and then wash from front to back the entire time. For a female patient, I would wash from front to back the labia majora, minora, clitoris, and then the vaginal orifice, each with different sections of the rags and then new rags. So after that's all done, I'm going to get new water, a new rag, and I'm going to flip the patient onto their side to wash their back. So you can lift up your leg and then flip over to your side. So I'm going to start by washing the patient's, up by the patient's neck and then working down their back. And then with a different rag, I'm washing from front to back their butt, getting any leftover stool or fecal matter and making sure that's all clean. And then I'm taking off my gloves, taking off the rag, and then getting new water. Now that I have new gloves on, I'd ask the patient, do you want a back rub? And just say yes.
Yes.
Okay. So for the back rub, I would start with the F-Lodge technique, which is starting from the sacrum and moving up, doing large circles. And then I would do the petrissage technique, which is going from the sacrum up and then going small circles down the patient's back, and then finish back up with the F-Lodge again. And then once that's done, I would flip the patient back onto their side.
Oh.
Okay, are you okay?
Yes.
Okay. And then I would lower the patient back to their laying down position. So the next thing that I would do is change the patient's gown. So I would ask the patient, I would help them remove their gown, take it down underneath the bath towel and put it in the hamper, and then help them put on a new gown beneath the bath towel. And then I'm going to remove the bath towel. Your arm. Okay, so I'm removing the bath towel and putting it in the hamper. And then I'm going to put on compression stockings for the patient. So compression stockings will go on the patient's feet, kind of like socks. We're going to pull them up over your legs. Make sure that you don't fold down your compression stocking, because if you do, it can act like a tourniquet, and it can cut off the blood circulation to your legs. Do you have wiggle room for your feet in these stockings?
Yes.
Yes? Okay, great. So before we move on to making the bed, I'm just going to take care of your hair care. So I'm going to raise the bed up a little bit, and then I'm going to have you lift up your head for me. Okay? And then I'm putting a towel beneath the patient's head, and then I'm going to comb his hair from scalp outwards. If this was a female patient, I would ask them how they like their hair done. The only hairstyle I wouldn't do is putting a bun directly in the back of their head, because that can lead to bed sores. Okay, can you just lift up your head for me? Okay, and then I'd remove the towel and then put it into the bag. So now I'm going to make the patient's bed. So I'm going to have you turn over onto your side again. Okay? And then I'm going to have you lift up your head. I'm going to move the pillow over to you. Okay, so while the patient's on his side, I'm going to take the sheet off the bed. I'm going to roll up the pull sheet and roll it and tuck it beneath the patient, and then I'm going to roll up the clean sheet, or roll up the dirty sheets and tuck them beneath the patient. And then I'm going to get a clean bed sheet, and I'm going to tuck this into the mattress. And then I'm going to roll this up and tuck it underneath the dirty linen, underneath the patient. And then the next thing I'm going to get is the new draw sheet or pull sheet. So I'm going to roll this up about halfway so it'll be underneath the patient when he rolls over it. And I'm going to tuck it underneath the clean sheet. So now that these sides are tucked in, I'm going to tell the patient, I'm going to have you roll back over to where you're on your side facing the direction towards me. Make sure you don't scoot, because you might mess up the linen and the way it's rolled. So I'm going to have you do that now. You good, bro? Okay, please don't fall off the bed. Can you scoot more towards, I don't want you to fall. Okay? And then I'm going to have you lift up your head so I can move the pillow. Okay? I'm going to lift up the railing so the patient can't fall. And then I'm going to, because of the way my bed's set up, I'm not going to be able to get this side quite as well. But right now I'm taking the dirty linen off the bed. I'm rolling it up away from me, and then I'm putting it in the hamper. And then I'm going to tuck in the corner of the new clean sheet, and then I'm going to unroll the clean draw sheet for the patient. So now that the bed's made, I'm going to have the patient roll back over to the center of the bed. I'm going to lower the railing and help them do that. You lift up your head. So I'm going to move the pillow back to the center of the bed so the patient's comfortable. I'm lifting up the railing, and then I'm getting the a clean sheet for the patient. Okay. Making sure that the patient's covered. And then I'm only going to do the mitered corner on one side because, again, of the way my bed's set up. So for the mitered corners, I'm lifting up the back side of the bed and tucking the corners under. Then I'm lifting up at 2 different points and kind of creating a triangular shape. And then I'm tucking the excess material underneath the bed. And then I'm folding that corner underneath and tucking it under as well. And then I would do that on the opposite side so that the corner looks neat. Do you have adequate foot space?
Yes.
Okay, if the patient didn't have adequate foot room, I would just pull up on either side of the sheet next to the patient's feet so that he could wiggle his toes. And then, after that I would grab the blanket from earlier. And then I would unroll it on top of the patient and then unfold it so the patient's well covered. The last thing I would do for making the bed for the patient is remove the pillowcase. So can you lift up your head for me? Thank you. So to remove the pillowcase, I would take it off like this and pull it down, and then dispose of it in the hamper. And for the new bed sheet, I would put it over the top and wiggle it down so that I'm dislodging as little bacteria as possible, and then I'd put that back on the bed for the patient. You lift up your head. Okay. So now that the pillowcase is changed, I'm going to demonstrate how to put the patient into a well-supported supine position. So I'm going to remove the blankets, I'm going to roll them up and then put them in the hamper. Okay, so for supine position, I want to prevent from cervical hyperextension or any neck and shoulder issues. So I'm going to have the patient, can you please lift up your head and shoulders for me? I'm going to move the pillow beneath his shoulders to support his shoulders and neck. And then to protect his arms and his elbows, I'm going to put pillows beneath his elbow joints. Put your pillow like that. And then I would do that for the other arm as well. And then I'm going to put a pillow beneath the patient's heels to protect his heels. Put your legs for me. And then to prevent from foot drop, which is a condition where if the patient's feet are in that, that flattened position for too long, a nerve damage will occur. I'm going to place a pillow to press up on the patient's bottom part of their foot. Okay, so then the last aspect of support for supine position is to roll up a blanket and then press it against the patient's hip bone, so that trochanter bone, to protect that, and then to protect the patient's knees from turning outwards while they're in bed for a long period of time. So I have this blanket here, and then I'm pressing it up against their hip bone. Like that. I'm just gonna fold this over. Okay. That did not work. Okay, so now that the patient is well supported in supine position, I would lower the bed back into its lowest position. I would raise the railings. I would give the patient the call light, and then I would clean up the room and clean up any leftover equipment, and then I would move on to my next patient's room. Thank you.